Okay, love you, baby. She always wants me to say that, you know, like they do at the Academy Awards. If it wasn't for you. Okay, our principal speaker today is Dr. Robert Kyle, and Dr. Kyle was born in Bottineau, North Dakota. Very small town. Current population, at least in 2000, the current population was about 2,600 people. And the nearest city is, wait a minute, just a second, I got it here somewhere. Oh, there is no nearest city. The nearest thing of any importance is the border between the United States and Canada. But Bottineau, just to digress a moment, Bottineau has the largest turtle in the world. It's called Tommy Turtle. No, that's true. This thing is 30 feet high. Fortunately for all of us, it's made out of fiberglass. Well, that's all there is to know about Bottineau. That sounds like a little song there, isn't it? All that there is to know about Bottineau. Anyway, getting back to Dr. Kyle, he was a very bright young man, and he went to college from Bottineau. He went to the University of North Dakota, and then later went on to medical school at Northwestern. And he interned in Evanston, Illinois, and he started his medical career at Mayo. But at one point, after he got to Mayo, he decided he might want to see the rest of the world, and he went back to Tufts in Boston, Massachusetts, an area that I'm from, and on a fellowship, and then later followed that with a fellowship at the National Cancer Institute. But then he scurried back to Mayo in Rochester, Minnesota, and he's been there ever since. A large part of his career has been devoted to teaching, and with a very strong focus on multiple myeloma. And many of the doctors, the young doctors today in the field, have been mentored under Dr. Kyle and have studied with him and have worked on certain research projects and papers with him. Some of them are right here in town at the Mayo Clinic up in Scottsdale. In 1996, approximately 96, I think maybe it was a few years earlier, we had moved to Wisconsin. I had a project there that I was working on, and I already knew I was a myeloma patient, that I had myeloma, and I was looking for a myeloma specialist in the area, but there wasn't really one. But my doctor recommended that I go see the guy who knew more about myeloma than anyone at that time, Dr. Kyle, who was at Mayo Clinic in Rochester, Minnesota. So Barbara and I drove the 300 miles over there and arrived in Rochester. I don't know if many of you have been to Rochester, but my first impression was I've never seen so many people in scrubs. It's just amazing. I mean, the whole town is essentially devoted to the Mayo Clinic. And I noticed also there were a lot of brokerage houses there. And so they seem to be doing quite well. I actually expected to see a Merrill Lynch brokerage house in the hospital when I walked in, but it wasn't to be. After the morning tests, which is a typical situation in Mayo, you take your test in the morning, you see the doctor later in the day. I finally met Dr. Kyle. I had not met him before. And of course I was scared. But Barbara and I found him to be very thorough, incredibly caring, and very patient with our questions, which is sometimes very important when you're talking to your doctor. Sometimes you feel like you're taking his time or he's rushing you along, but not with Dr. Kyle. So fortunately, I was stable, and he did say, oh, by the way, you have a thigh bone that's, you probably ought to get taken care of. And I said, what's the problem? He said, well, it's very thin, and it could snap and cause major problems. So I said, well, okay, well, I mean, do I have to do this immediately? He said, yeah, you should do it immediately. So he said, we can do it tomorrow right here if you want, but I kind of backed away from that. I was still in shock. And later I had it done back in Wisconsin about a month later. But I walked very gingerly in the meantime. So that was my first encounter with Dr. Kyle, and I had not seen him until last night. We had a little reception and roundtable discussion. He's been a visiting professor at numerous universities and colleges in the United States, throughout the United States, and also overseas. He's known in Canada, Israel, Sweden, Italy, Czechoslovakia, and Hungary. And he's considered the true expert in this field. He's received many honors in the field of hematology and myeloma from these institutions and a couple from foreign countries. His contributions toward a cure for myeloma have been immense, and he's recognized by his peers as being preeminent in this field. Dr. Kyle has been involved in myeloma research for many, many years, and he's written and co-authored numerous articles in various technical medical journals. His work has probably advanced, I think it's safe to say it definitely has advanced the place we are currently and the knowledge we currently have about myeloma. All patients here today have benefited from his devotion to fighting this cancer in one way or another. New drugs and techniques for applying them have been developed from his studies and those of the doctors that he's influenced in his long career. And doctors and others that he's mentored over the years, and they can still use him as a resource if they need to.